I am Althea Morrin, and this is my handling plan assessment. How to handle an animal that may already be stressed and anxious without causing them more unnecessary stress and making them more anxious. The scenario I have chosen for this assessment is of Max, the 3-year-old border collie who presents to the clinic with high marked anxiety. Clinical signs that have been observed include panting, intermittent vocalization, wide eyes, a tucked tail, excessive panting, and trembling. His heightened stress has made it difficult in the past to perform thorough routine examinations and administer necessary treatments. Max's clinical signs mean that he is communicating with his human that he very much does not want to be at the vet and is begging them to take him home. Throughout this presentation, I will be talking about the FAS, or Fear, Anxiety, Stress Score Spectrum, communication cues, learning new behaviours, and low stress handling. All of these are encouraged by the organisation Fear Free, who are committed to making our pets feel safer in the vet clinic and at home. Communication cues. The FAS score spectrum, which has been developed by the Fear Free organisation, goes from 1 to 5. FAS score 1 is where the dog is happy, their tail's wagging, they might be smiling, their ears are relaxed, their body is relaxed, and there is no sign of fear whatsoever. FAS score 2 is where the dog is flattening their ears slightly, they're beginning to pull away a bit, their tail is beginning to tuck, they're a bit unsure about what's going on, but given the ability to go at their own pace and time, they will be willing to participate. FAS score 3 is where the dog is actively pulling away, their tail is tucking, their ears are flattened, and they're just very much trying to get out of this situation. FAS score 4 is where the dog is whining, hiding, the tail is fully tucked, their eyes are wide, they're panting, they're trembling, and they are one step away from aggression if their cues continue to be ignored. Now, FAS score 5 is where they become aggressive, lunging, biting, and barking, because their communication cues of their discomfort have been routinely and continually ignored. Now, to help Max, I would call him into the consult room from the door, then move to the opposite side of the room. This will allow Max to get used to being in the room and to my presence, while with only his owner's calming influence nearby. And because of his fear, I would not start the examination right away. Instead, I would give him time to decompress, give him some treats if his owner says this is okay, crouch down so I'm not so tall and scary, and if he lets me, very gently pat him on the shoulder. Now, I would have his human there to give comfort in the form of pats, cuddles, and verbal reassurance, as well as a way to learn how to interact with Max in a way that makes him feel safe and comfortable. Because I do not know Max very well, aside from what is in his file, learning the ways to make him feel safe and comfortable when interacting are best learnt through his human, who is around him every moment of the day and knows his communication cues better than myself. Now, only once Max is calm, meaning that his FAS score is at a 1, will I start the examination. An FAS score of 1 means that Max is no longer pacing, excessively panting, or trembling. He's wagging his tail and he may even be smiling. His eyes are not showing any white, his ears are relaxed, and basically he's just completely relaxed overall. Now during the examination, I will prioritise what is most important and leave what isn't. This is to prevent Max becoming overwhelmed by the process and make coming to the vets a positive experience. According to the 5 freedoms, Max is unable to exhibit normal behaviours because his anxiety is very high. He may have other diseases or injuries that I am unable to detect or notice, either with or without sedation, because I am unable to examine him. Max's anxiety cues, if continually ignored, may make Max unable to come to a clinic or even see a vet at all without him becoming aggressive. This is because he will have learnt that unless he shows aggression, people are not going to listen to his communication cues or respect his boundaries. Learning new behaviour. Now, since Max is already 3 years old in his juvenile stage of life, and depending on how well he has been socialised by his human, he could be struggling with all the sights and smells of other animals in the clinic, as well as just being at the vet clinic, because there is so much that goes on in a vet clinic on the day-to-day. As a border collie and more than likely a herding dog, Max may be more used to the quiet countryside, where the only sounds for miles are the sounds of the farm, the animals on the farm, and the normal sounds of his home. This means that the vocalization from the other patients, from birds, bunnies, guinea pigs, possibly other exotics, cats and other dogs, as well as the smells of the food, the treats, the chemicals, the other animals, and whatever smells are coming into the clinic from outside, are likely overwhelming him and overstimulating him due to their unfamiliarity. Cooperative care training, which is encouraged by Fair Free, if done properly, will help Max learn that the vet clinic isn't a scary place. If the owner starts with happy visits, where they go to the clinic during a quieter time, such as just after opening or just before closing initially, go inside, Max receives a treat and praise, then they walk around a bit to get Max used to the sights and smells of the clinic, then leave. As the happy visits continue and Max starts showing signs of improvement, the owner can begin coming into the clinic for these visits at busier times. With time, consistency, praise, and patience, Max may begin associating the vet clinic with positive experiences, which will overall lower his FAS score and may actually make him excited to go to the vet. Because of this, the resulting vet visits and procedures that may need to be done, from something as routine as annual examinations or vaccines to the more intense, like surgeries, will become safer and easier for both Max and the vets and vet nurses. The client can also do fake examinations at home to desensitize Max to the process. The main goal with these is to get Max used to having his paws touched, his nails clipped, something poke his back end or neck, his body being lightly poked and prodded, his ears and tail being lifted, and his face being lightly fiddled with. If the client isn't compliant during this process, Max will not learn new behaviours or communication cues, and vet visits will become harder for both Max and the vets and vet nurses until the vets can no longer see Max for their own safety. Low stress handling. Now, prior to Max's visit, I would prepare the consult room very well by ensuring I have all the instruments and tools I need for the examination, such as needles, vaccine vials, nail clippers, buzz cutters for if I need to draw blood, and any other equipment in the room before the appointment starts. This will ensure I am not continually going in and out of the room during the consult. This will allow Max to get used to my presence and scent without constantly changing the environment with new smells every time I would leave or come back to the room, because a constantly changing environment would only heighten Max's FAS score and make the examination more challenging. I would also spray a soothing pheromone spray on both myself and the consult room about half an hour to an hour prior to Max's arrival to give the medical smell of the pheromones some time to dissipate, leaving only the soothing pheromones. I would also try to minimise the amount of time Max has to spend in the waiting room or reception area, because the sights and smells there may overwhelm him. If I can, I will bring Max into the consult room as soon as he arrives to bypass this, and if this is not a possibility, I will be as quick as I can with whatever it is I am doing to minimise the time he spends there. Hopefully, each of these steps, when combined, will create a more stable, safe, soothing, and just overall a better environment for Max for this visit in particular. And hopefully we'll begin the process of making him associate the vets with positive experiences rather than negative ones. For the examination, I will put a non-slip mat on both the table and the scales, so that while Max is on either one of these surfaces, his paws are not slipping and sliding around, which will only make him more scared and heighten his anxiety. Then, once the weighing is done and Max is either on the table or on the ground, depending on what he's more comfortable with, I will have his owner stand or crouch by his head, distracting him in the form of pats, cuddles, treats if he's allowed them, and plenty of verbal reassurance while I conduct the most essential parts of the examination. Whenever Max starts showing any signs of discomfort whatsoever, such as pulling away or even growling if he is that way inclined, then I will stop, take a step back, give him a few moments to decompress, then praise him for telling me that he doesn't want what was happening, and maybe give him a couple of treats if his owner says that is okay. Only once Max's FAS score is back to a 1 will I continue where I left off. However, for this visit, I will prioritise what is important and leave what is not. And for this visit in particular, I will avoid using any physical restraints whatsoever, as Max is already scared enough, and use of physical restraints will only heighten his anxiety and push him closer towards aggression. And honestly, it will be counterintuitive of all the other steps I have taken to make Max feel that the vet is a good place to be, not a bad one. If Max does not feel comfortable in the clinic at all, full stop, will not calm down, Then I will ask the owner to take Max home, reschedule the appointment, then possibly drive out to where Max lives if he is in the countryside. Doing the examination at his home, where he feels safer and where it is quieter, may allow me to get the examination done and any treatments administered without Max becoming scared. If that visit goes well, then we can slowly, over time, work up to bringing Max to the clinic for his routine examinations and any other necessary procedures. I'm Althea Morrin. This has been my assessment on handling. I hope you have enjoyed it. Have a good day.